Here are two high-yield USMLE-style questions focused on Down syndrome, trisomy 21. Question 1. A 28-year-old woman undergoes prenatal screening and is found to have an increased risk for Down syndrome, trisomy 21. Which of the following is the most common physical finding in an infant with Down syndrome? A. Single palmar crease. B. Cleft palate. C. Shortened femur length. D. Wide set eyes and flat nasal bridge. E. Low birth weight. Answer A. Single palmar crease. Explanation: one of the classic findings in Down syndrome is a single palmar crease, also known as simian crease. This is a common physical feature of trisomy 21 and is often seen alongside other features like flat facial profile, epicanthal folds, and shortened fingers. Wide-set eyes, flat nasal bridge, and shortened femurs can also be present, but the single palmar crease is particularly characteristic of Down syndrome. Question 2. A newborn is diagnosed with Down syndrome, trisomy 21. The child has the characteristic flat facial profile, epicanthal folds, low-set ears, and congenital heart defects. Which of the following cardiac defects is most commonly associated with Down syndrome? A. Ventricular septal defect, VSD. B. Tetralogy of Fallot. C. Patent ductus arteriosus, PDA. D. Atrial septal defect, ASD. E. Coarctation of the aorta. Answer A. Ventricular septal defect. Explanation: congenital heart defects are common in Down syndrome, with ventricular septal defect being one of the most frequent. Other heart defects that can occur in Down syndrome include atrial septal defect and patent ductus arteriosus, PDA. However, VSD is particularly common and seen in about 40 to 50% of affected individuals. These questions